All right. Good day, everyone. Good day to you watching. Welcome to the Unpack It podcast. My name is Ayola Akinwumi, but you can just call me Akinyo, right? This is Unpack It podcast where we have conversations about mental health, your mental well-being, how it affects you, your society, and the world at large. Right, that's very simple, right? This podcast is brought to you by the I Choose Life Foundation, powered by the I Choose Life Foundation. Fantastic organization. You can know more about us just in the descriptions. And the conversation that we are unpacking is in commemoration with the World Mental Health Day. So today is World Mental Health Day, and the theme for today is access to services, mental health in catastrophes and emergencies. But as you know, we are Nigerians, we are based here, so we're going to localize this basically to access to services in mental health here in Nigeria, and we're going to be unpacking a lot of amazing conversations. And to help me drive this conversation and ensure that we actually unpack it, we have two amazing guests in the studio with me. And to my left is one and only Dr. Hope Umeza. Dr. Hope, how are you today?
I'm very well, thank you very much. We're here to unpack it.
Let's unpack it. I'm very happy to unpack it. And to the right is Mr. Victor Igwe. Mr. Igwe Victor. Does that make you happy?
Oh, hello. Hello, everybody. I'm happy to be here. And like he said, we're here to unpack every emotional baggage you have. Stay tuned, please.
Interesting. All right. So we're unpacking conversations today.
True.
And today we want to unpack the conversation around access to services, access to mental health services precisely. And before we get into access, can we lay the foundation basically for what is mental health? So I know for shorty that a number of people still have different takes on what mental health is. There are misconceptions. People still have certain matters. So just to help the drive of this conversation, can we try to lay the foundation straight a bit? So what is mental health? Let's have Dr. Hope first.
Yeah, thank you very much for having me again. You see, mental health, I say, is a continuum. Individuals feel that mental health is a sport, is a status that you achieve. But mental health is a continuum. It means that if you have mental health on a scale of 1 to 10, right, you are not likely to be 10 all the time or 1 all the time. So you swing between the scale. And so to put it by WHO's definition for mental health, it cuts across various facets that affect human life. So mental health is defined as a state of well-being where an individual is able to realize his or her own capacity, abilities, is able to learn well, is able to work productively, and the person is able to cater and cope with daily life stresses, and finally contribute to the society, to the community where that individual belongs. Right? So you see that it cuts across your work life and many other areas. As a matter of fact, some other definitions have added spiritual well-being as a part of mental health. Right? So unfortunately, you've seen people say, oh, he has mental health, as if to say or to mean that the person has mental disorder. No. Right? So that's why I say mental health is a continuum. Right, thank you very much.
Yeah, thank you very much. That is a very, very important one. When people say, this guy get mental health, this guy get mental health, they end up to say that, oh, you have a problem. And whereas mental health is just like your physical health. It's as important. Do you want to speak to the importance of mental health in relation to physical health? Like you go to,
having a positive mental health is what makes the wholesomeness of a human being. You being able to understand your strengths and weaknesses as an individual is what brings out that uniqueness in you as an individual. So you can't tell me you're physically healthy when you don't even understand the state of your mental health. Understand? So it's just like an individual having having to repeatedly do the same thing over and over again, expecting a different result, knowing fully well that his mental state, he's being hindered by possible decisions that he could have changed or he could have altered to have given him a positive result. So having a positive mental health goes a long way in equipping your physical body and your state of mind.
Interesting. I like your concept. I used to say something that your mental health when you are on the good side. So let's do like according to what your Likert scale. You have 1 to 10, right? So when you are 1, it means that you are on the not so good side, right?
Not so
say
good.
you are on 10, you're on the good side. So I like to say mental fitness 10. So it means that you are physically fit. That so this time around you are mentally fit. You're like good, and then 1 is mentally unfit. Does that pass?
Well, in mental health, we are also careful with labeling people with diagnosis, right? So, which is why we have several regulatory protocols for making diagnosis for individuals suffering mental illnesses. We have the ICDs and another protocol guideline for making diagnosis, right? So, if you say someone is mentally unfit, because I said earlier is a continuum and it goes to and fro, So it means that if I see Mr. Igwe tomorrow, because you have said he's mentally unfit yesterday, but today he's fit. So you see, we don't want to label people. Well, it's okay to say he's in a good mental state.
Good mental state.
It's like the difference between I like my cup half filled or I like it half empty.
Okay.
Do you understand? So I'd rather say, okay, let me say it's half full. No, I mean not half empty. Right. So I think we should have a positive way of approaching issues that has to do with mental health, especially in our setting where people are not so educated and it's surrounded by so many myths, that further compound the problem for those who suffer real mental illnesses. Right.
Okay. Yeah. Thank you very much for the clarifications. I think to an extent we have been able to lay the foundations of understanding what mental health is. And so, to further unpack the conversation, access to the services in mental health. Currently, people have a perception that mental health issues, challenges are on the rise in Nigeria. Would you agree to that? Is it actually on the rise or not?
Well, I would first of all start by giving a categorical statistic analogy as postulated by the World Health Organization. We have about 20% of our Nigerian population that are currently facing mental health struggles. And 10% out of that 20% don't even have the access to positive and credible mental health facilities or care.
Okay, sorry. Let's break it down to make it more easier. But we say statistics. The current statistics is that we're about 200 million,
200 million,
people
yes.
in Nigeria. So by the numbers, you are saying 40 million people
Exactly.
are dealing with mental health issues.
Yes.
So that's that's like every 1 in 4.
Exactly.
Okay.
So the thing is that in line with your question, yes, there's an underlying issue, and it cuts across all sectors and not just the mental health itself. Cuts across all sectors.
Interesting. Dr. Ho, what we have to say to that? Statistics increasing.
Yeah, of course. You see, we've seen a rise of people suffering mental illnesses, and of course, the need also for care, right? And in Nigeria, we have a huge parity between caregivers, care providers, and those who need the care, right? We have about 1 psychiatrist to about 1 million Nigerian, all right? And we have 1 clinical psychologist to about 700 to 800,000 Nigerian, right? And then we have 1 psychiatry nurse to about 200,000 Nigerians, right? Now, this is just to give you a glance into the scope of specialties that you need. For example, if you're institutionalizing treatment, And then at the same time, of course, outlets like the Choose Life Foundation's helpline, if you are escalating, you are escalating beyond maybe someone who has a capacity to offer a mental health first aid. You are looking at a clinical psychologist having to see a patient. All right, I think about 2 months ago, someone that I Choose Life had referred, reached back and said, "Thank you so much for the service that was offered." She had about 7 sessions in total, virtually, after she made the first call to our Choose Life helpline. Right now, so if we do not have a clinical psychologist, you won't be able to escalate. So you're just going to be saying, "Let's trust God," as typical Nigerians we do. Right, so and then we spiritualize it. Nigerians are used to mystifying what they don't understand.
They don't understand, yes.
Right, yeah.
Okay, so I think there are 2 angles that has popped up right now in your responses that I would like to delve into. One is the statistics, the ratio of the professionals to the people that need it, right? So let me put it like this: ratio of the supply to the demand.
Yeah.
And then the ratio, not ratio now, the situation of spirituality, people spiritualizing every single action. So let's take it bit by bit, right? So let's start from the numbers. I was speaking to a friend, he's a lawyer, he recently called to bar, and we were just trying to, analyze situations, and he was saying that there are about 10,000 lawyers called to bar just this year. I'm like, okay, interesting. And he was like, how many law firms do we have? Like, where can these guys, how is it going to be like? So this is my question, right? We have a lot of graduates being churned out yearly. I mean, schools, in every 3 months, in every 4 months, you are hearing some people are graduating, some people are leaving school. Yeah. Now we have people studying these courses and stuff. Why do you think we have this shortage? Why is it there? What do you think your take is?
Yeah, Ayola, I think you have a problem with recently called to bar lawyers because you seem to emphasize, at least on 2-3 occasions now, recently called to bar. You don't think that could be emotional or bullying or something?
Well,
there
is no attachment.
Okay, however, you see, to answer your question, right?
Yes.
We hope that we get into a better landscape for professionalism in this country, right? I had a patient whose elder brother was supporting treatment for, and upon her discharge, he reached out to me and said, "I need to speak to a therapist. My sister had told me how wonderful your experts are." And I was wondering, you are in the UK, why can't you access a therapist?
In the UK,
right? In the UK. And he said, it's not as easy to see one as it is in Nigeria, even though we think it's that bad. Now, what is the uneasiness there? It is that you pay more. You pay a lot of money to see a therapist or a licensed clinical psychologist, right? Now, so it means, therefore, that if I am a clinical psychologist, I am going to leave this country, perhaps, and go to somewhere that I will be paid more. Now, which is what this year's theme of Mental Health Day is about, right? Humanitarian humanitarian in mental health in humanitarian emergencies, right? We must begin to put a human face. Like my brother here, who I guess will be on this seat very soon, had told me earlier how that, he just want to reach out to people. He just wants to make the impact, with the skills he has learned, right? So we are all going to have to own this, that we have no other country to call ours. The simple reason why our universities keep churning out experts, doctors, nurses, every other professionals, but yet we don't see them on the field in Nigeria is simply because they don't probably have an enabling environment to function. I mean, simply put, right? So,
I think that's very, very solid, actually. I mean, the fact that the society is not allowing these people thrive as much as they want to, it speaks to reasons why we have shortages and stuff. But I like to bring it in a different direction for you now. The Choose Life Foundation has a helpline. Victor is the one in charge of the helpline. And I want to know, can you speak to the importance of, how do I put this? Yeah, the fact that we might not exactly need to depend so much on the professionals, right? Let's start from somewhere. Now, we have other people that help in picking the helpline calls that are not licensed, but then they do the work, right? They come out to, pick the
Volunteer.
call, to volunteer, to all of it. So, can you like speak to the fact? Yes, we understand that there is a shortage. We understand that the system is not allowing people to thrive as much as they want to. The basic needs hierarchy, Maslow's theory of of needs.
Need.
Yeah, where I mean you need to feed yourself.
It's a logical.
Yeah, they need to eat, so they definitely want to go out.
Mm.
But can we look at it? Yeah, we have this challenge. We have this. What is the role of the person watching this right now in ensuring that we don't keep clamoring and saying that we don't have this, we don't have that, we don't have this?
Well, first up, I have been able to, have a singular opportunity to work with I Choose Life Foundation, and I'm still working with I Choose Life Foundation as a helpline correspondent. And I can categorically tell you something for free. Every call that comes in is tied down to series of traumatic experiences due to either negligence or ignorance. And awareness goes a long way in making sure things like this are brought to the limelight where people can access us, right? And we've had to counsel series of cases from individuals who've called despondent individuals in quote, who have called in to tender their emotional grievances towards their lifestyle. And most times you see that it goes beyond the scope of just having the certification as a psychologist. Now it boils down to you having the empathy as a human being. In order for you to be able to understand and to conveniently flow with the grievances of these individuals. I've handled a case of an individual recently. The person had issues, family issues. Now these issues boil down to family abandonment. For some reason, she hadn't been having the care of the fatherly love. It was missing in her life. So she did something. She started seeking out that affection somewhere else. She started going out in order to get. And the thing is that one thing about this issue is that these people don't know that these are the things they have. One thing that comes to mind when you are having problems like this is the awareness of the problem and the acknowledgement of the problem. So it becomes easier for you to let the counseling permissibly go through you in order for wholesomeness to take place, right? So most of these persons, when she had this issue, the person reached out, and I realized that it's been an underlying issue, not just from her side, but from the perspective of family abandonment. She's had issues with family. She's had issues with her father. She's had issues with her mother. She was raised by a single father, so the connection was not there. The affection was not there. She decided to go outside to sort things out like this for herself. I had other issues with callers calling in to seek emotional support because they've been mentally drained. They've been fatigued mentally. People with suicidal ideation, people with emotional distress. This particular case was a case of an individual who called in, and the coping mechanism she used for herself was to inflict herself personally. She inflicted herself with blade tears in order to feel the pain, so she can have that comfort. It's a coping mechanism for her. So she can have the footages are there, so she can have the comfort of, truly I'm human. Because most of these people, they don't even have emotions anymore. For some reason, I think they've experienced more than life can give, and they feel they've been neglected by life. So their emotions are down, the emotional level are down, the emotional quotients are down. They don't have anybody to speak out to. So we've been able to bridge the gap between ourselves and our second responders, who are the clinical psychologists and the experts who we refer these people to. So it's been an amazing journey so far.
Lovely. Thank you very much. And I think what I really point or try to juice out of that is that you don't have to be an expert. You can just lend a listening ear to somebody.
Empathy is all you need to help someone suffering from a mental distress. Just cultivate that spirit of empathy.
Empathy.
That's all you need to be able to see through the problem of other people. You
Interesting.
don't need to get a certification to be, or you need a certification, but you just need that quality of a human being by having the nature of empathetic or being empathetic.
Being empathetic about it.
Yeah, Ayola, I agree with him, right? So, but you see, you don't need to be an expert, but you should also know how to refer to an expert.
Yeah.
Right? Okay, so I think I just wanted to add that, just so that we are able to carry, the burden of those who need care. Right.
To balance
You
it.
don't have to be an expert, but you must know how to refer
To an
to
expert.
another expert. Wow.
That's why Actual Life Helpline is here for everyone.
Thank you very much for that.
Yeah.
He was speaking about something in terms of layers that can form a resistance to the help passing through to the people that need it. So what do I mean? I am in need of mental health help or care, and I am not even allowing myself to receive the care from people. Now, I want to bring this back or tie it back to what was initially mentioned, spirituality. So, what role do you think religion, spirituality plays in creating barriers for getting help? Right? If you read a lot of research work by people, they tell you that it's a major challenge. People think that mental health challenges are spiritual. Like you have this problem and you're like, take this guy to the clinic, to the pastor. And somebody was talking about he went to a school with almost quite a big school, right? 200 or more than 200 students. That's a lot. And then no counselor, no psychologist, and then they're like, why don't you have one? Oh, we have a pastor. How? So I know that spirituality has a role to play, but how can we really, dissolve this to understand the roles of it?
Yeah, you see, spirituality has a huge role to play in mental health and, of course, other areas of medicine, right? So, but the same way that a particular object has advantages, it does have disadvantages, right? I counsel people and I say, if you take your drugs, your medications for hypertension, it doesn't mean or doesn't stop God from healing you. Do you get it now? Right? So, because it also affects even relapse, spirituality affects even relapse. You see a patient who has stayed in the facility for 3 months, 6 months, or even 1 year, and then at discharge, you've counseled parents. Even before discharge, months before discharge, they're asking you, so what is next for this guy? Because in part of the treatment plan, you have an after discharge plan management, which is done even while in treatment. You look at what environment this person coming into, what are the emotions, what are the triggers, and what can be done to modulate the environment. And the families are aware that this person should come in for outpatients, right? Now they return home and somehow the mother tells you, you know what, affliction is not going to repeat itself the second time. Or, oh, he didn't know, we just got to church and pastor was not even aware that he just came from a rehab, said that you are not going back to where you're coming from.
Exactly.
So, and I keep saying it, that the fact that you come for follow-ups and checks does not stop God from healing you. Science is a part of God knowledge that God gives to people. The same thing, medicines. God gave the knowledge to people. If God didn't give the knowledge to people, we won't have it. Right? Now, I'm very familiar with the Christian fold, where you have like Daddy Adeboye, with the Redeemed Christian Church of God. They do have a rehab center. I think Kada.
Oh yeah.
Right? Now, I think the Oedipo too has a rehab center also.
Yeah, we partner with Wellspring, right? Wellspring.
Wellspring.
Now, do you see that?
We're in partnership with Wellspring.
Yeah, so if you are talking about spiritual fathers, which they are one of, they have rehab centers. So it doesn't mean that they are faithless.
That's where the awareness comes in.
Okay, so we must understand that spirituality has got a huge role to play. Right. In fact, in the course of recovery in the facility, there's a program we call the 12-step program that is part of the treatment protocol for them. And this 12-step program is a spiritual-based program. It first of all helps you to understand that, you see what, this addiction is beyond you. All right. Okay. So you've got to believe in a supreme being to help you out of this. All right. So, and help you again. Other steps help you reconcile. You learn to pray, and so even if you worship this cup with the label "Unpack it," you got to wake up every morning and say, "Unpack it, cup." Right. So
Yeah.
you should believe in something. All right. So it has a role to play. But again, we shouldn't overemphasize it to a point where it takes us out of the benefit of other areas of need that we require. Right.
Yeah.
Sorry, just like let me just add to what you said.
Yeah.
I totally agree with everything you said. But a friend of mine said something. He said, when you leave Nigeria, you realize that your prayer point here are answered prayers over there.
Mm-hmm.
You understand? So I strongly believe our level of religious extremism here in Africa has pushed us to an edge of not coming to the realization that we need help. When it comes to professional grounds.
Yes.
We truly need help. We are too macho like when it comes to our emotion. We are boxed up when it comes to expressing our emotions in Nigeria, especially. So I feel our spiritual heads, can go a long way in sensitizing their audience because they have a larger audience. The imams, the bishops, the priests, and even the pastors. It can go a long way in sensitizing their audience that, this thing that you are saying, not everything can be done from this altar. Reach out to these people. Reach out to this level of expertise. Seek your help from this thing. There was a message I was listening to recently by Pastor Aaron. He said he had a friend he has been trying to link up for a particular gig, and for some reason he had a deficiency in the qualification he was going with. This guy has been praying, but the problem is you. Not realizing you were the issue was the major issue why we are having setbacks. Now he couldn't realize that he was the major problem. He was a stumbling block to his own problem until it became an awareness for him that, he had to realize this was after series of rejection from different job offers. That was when he got to the realization that, I need to sit back and I need to make adjustments on this. So I think a little reduction in our religious extremism when it comes to how we postulate things in Africa would help us see things beyond our scope.
Very, very, very well said, Mr. Victor. I think that we are very right, and when it comes to the religious aspect of it, Nigeria, not just Nigeria, Africa, is very big on that.
Yeah.
But instead of using it to your disadvantage, use it to your advantage. I think that's the main message.
Major is a psychological counselor.
Yeah, I think that should be the message that should go out.
These are scary times.
Right? Use it to your advantage. Use it. So even if you're not going to use it, okay, if you're not going to use it at all, ensure that it's not harming you. That's even if you're not going to use it. But if you're going to use it, ensure it is to your advantage and not your disadvantage.
Exactly.
I think that we've been able to, discuss in-depthly on, breaking these things down and how that it can affect access. Because we see that if you are thinking this is spiritual, this is this, it can limit the way you have access. Because look at it now, ICLF, for example, Vigada, for example, have toll lines that you can call. They have call lines that you can always reach out to somebody to get something, right? Because you are believing in a certain manner or you have a certain belief, you now feel like, I'm not reaching out to these people. So I think that's another part of access. So the service is there, but you're not using the service.
You're not utilizing it.
You're not utilizing it.
Speaking of access, so sorry to call you. Most times isolation is one of the biggest issues that gives people the ability to not even get access on time. a lot of people feel they are beyond help. A lot of people feel their problems are irredeemable.
Let me say something. I learned something recently. Someone said you can be insulated, but not isolated.
That's it.
In terms of you are in the midst of the market, but you are not going to allow the vices in the market get to you.
Yeah.
Because at the end of, I think that's what you're trying to buttress. Yeah.
Exactly.
So it's very important that you are not isolated from what's going on. Yeah. So learn, but be insulated. Learn to understand your coping mechanisms, understand how these things work, and so that you are not just out of the word. And it speaks to spirituality, speaks to every other thing in terms of like, don't just be in that world. Understand it. God created the world. Yeah. So explore the world that He has created and understand that. And I think that's pretty much just to wrap it up, right? Few things that you've mentioned about. Hey, I'm trying to remember right now, but you were talking about don't just listen, but refer. Learn to be empathetic. Learn to listen to people, but also learn to refer them to people. And then we just spoke about isolation again. Don't just be isolated, be insulated. Ensure that you are not going to put yourself at the risk of getting hurt or whatnot it might be. So at this point I would like to extend it to our audience in the house in case you have a question or a take, right? So yeah, we are open, and then so that we can just wrap it up as quick as possible. Anybody in the house?
Okay. I was going to ask, I have two questions actually. Like, what would be the cost or the ratio of clinical psychologists to people who need mental health care? Like, what would be the cost? Why is it low? Could it be that because of the attitudes towards of Nigerians towards mental health related problems or therapy? Or it could be that clinical psychologists or professionals are not like practicing after graduation.
That's one.
That's one question.
Yeah.
Okay, yeah. And the second one, I'm actually just curious for professionals like you, psychologists, Mr. Hope and Mr. Victor, if you need mental health care, for instance, since you guys are like the blueprints of like you create mental health care for others, do you like feel the need to seek help since you already know? I don't know if that makes sense. You already know what the professional is going to tell you.
As a graduate of psychology, I can tell you that a lot of psychologists will not practice psychology in Nigeria because of the lack of motivation. But first, from your lecturers, when your lecturers tell you this course they are doing, you know how you end up now. You just go and open a church and you cash out. You get me? So, first, the motivation, your motivation dampens from the place of study first, and then you come out to the society and you see that you're not even regarded, you're not even reverenced the way you ought to in a society that over half of the population are mentally dysfunctional. You're not giving that regard as a mental health expert that you are. And thirdly, it boils down to the level of commitment. Not everybody is willing to commit themselves in absorbing the problems of other persons. Most people just go to school because they just give them the course to study, but they will come out and they won't even practice it. Most of them never had interest in studying that course in the first place, right? So the motivation comes in, the lack of commitment comes in, and then we also have underlying issues from the government too, not setting up proper structures for people like this to practice when they're out of their institution.
I think you have an interesting take, but I mean, I'd like to hear your take as well. But this gives room for people to explore. So let me put it like this to sum up what I'm trying to explain. Your light is not going to make sense where there's light. Does that make sense? Right? Light is best appreciated where there's dark. There's darkness. So yes, we understand that there's this shortage. We understand that the community or the society is not allowing you to practice and stuff. But I believe you can still step out to make the difference. I mean, that's why you're here. That's why we have bigger dark. That's why we have the other.
That's why we have Unpack it.
Do you understand?
Mm-hmm.
So your light is not going to be appreciated where there are other lights shining. So yes, we understand the problems that is happening. The system is this. You don't have motivation. You don't have that. But if you were to speak to a young adult that is just a recent graduate from the university, knowing the problems that we have, what would be your, should I say, what would be your advice? Having understanding that there's a lot of markets to tap.
Well, there are many markets to tap, right? And it's not just about. I saw a tweet making the round some time ago, and someone had tweeted that if you have money, you don't know what to do with it. Go open a dialysis unit, right? Because women and of course men too, they use many skin whatever, just to, and of course the high speed of drug use is also giving a rise, in people or individuals who would need dialysis in the future, right? So, but that means there are many markets to tap. Now, so if I would say, I would want to approach this from the point you laid. Light is appreciated in the dark. All right. So, with what I Choose Life is doing, if there is no helpline today, I can tell you that there are many organizations who have keyed into this and opened helplines too, because I Choose Life did. All right, and then of course it wasn't a big deal. It was an opportunity for the Ministry of Youth to say, oh, we have a youth help desk at the national level, and we have young people calling in, calling in to complain about police brutality, calling in to complain about scarcity of fuel, job placement, and the rest of the things. Now, but there are going to be youths who would call and their problem borders on mental health or even drug addiction, right? And so it was a hit for the Ministry of Youth. Let's take the opportunity to partner with I Choose Life Foundation, who already have a functional helpline, right? You see that. So you see that's light shining, right? So we must, I'm sure that the audience is not just people who need care or access to care. There will be caregivers who are listening or would watch this today or tomorrow, right? Now, so it's a message to them, right? So we must begin to raise our need level according to Abraham Maslow that you mentioned earlier. It's a pyramid. It's a 5-level pyramid, right? And the base where everyone is crowded is the physiological need: what to eat, what to drink, right? So, but we must begin to look at humanity as us, right? So if as a doctor, if you're going to look at the prevailing condition in Nigeria, they may call you at night and you say you're not coming out. I mean, 3 nights ago, a woman called me at 3:30 a.m. I had to drive to a location 25 minutes distance to go pick the man up because he was erratic. He was out of reality. And when the woman called, I heard the daughter shouting, "Daddy, please." They were in terror by the husband's behavior. So if we say, you know what, madam, let me sleep, you're right. So some things will go wrong. Okay, so I think we must show empathy. Empathy is not in words; it's in action. All right. So empathy is not in words; it's in action. So we must practice what we say. Yeah. So let's leave the part. Yeah, we know government is not doing enough. Right? They are doing their best, but we know that there is room to do more. All right. So while at that, we also need to match the energy we want to see in government. Let's show it in what we do in our day-to-day life. And I keep saying that our leaders are not from the moon. They are a crop of the population.
Yeah.
Right? They didn't just appear from nowhere.
Absolutely.
They didn't come from Mars. They are all from us. So so they represent the larger percentage of the people who are complaining about them. All right. So I feel that we need to be, as professionals, we need to begin to change our motivational levels or backgrounds, for reaching out to humanity. That's one. Now, secondly, again, talking about the light in darkness, right? Now we need to take access to people who are disenfranchised by geographical distribution, right? You see most of the experts, the few available in urban areas, in Port Harcourt, in Lagos, in Abuja, in Enugu, urban areas. You really see maybe some in Kogi State, where I'm from. Right, so and
we get calls from Kogi State. People who need help and all that.
All right, so it's we had to say, okay, you know what? Can we have satellite clinics? We have a community-based drug rehab care programs in 2 wards in Kogi State, right? And in Abuja, 2 years ago, we had experimented that in Bagalape community and then Wumba village, somewhere around Apo axis, right? Where young people are able to come in and see experts. They had free drug tests, free therapy sessions. A partner came in and trained them on hands-on skills, right? Now, so there's a lot that can be done. If I tell you the outcome of the community-based program we are doing, in fact, is even more efficient than institutionalized treatment. Know what I mean by that? You have people who are willing to come for treatment, who are coming every day for therapy sessions. That's a lot of effort, right? And then whatever the stipends you are giving to them is not a big deal per se, but they are coming and they are being tested. They know they are being tested every month. All right, and they are negative to the drug test. Some are able to think clearly, reunite with families, go back to gainful employment, start writing exams and preparing for exams to go back to school. You see the change that is being drastic. And how do we do it? The therapy sessions, we don't have experts favoring to Kogi State. Technology. The same way I just live employ technology in the helpline is to connect Google Meet links, and then we have a big screen in the hall where they come in and our experts, start speaking to them, and it's this yielding results.
Absolutely, I think. Okay.
Let me address our shortage. That question.
All right.
It's a big question and it's a big challenge to mostly every prostate in Nigeria. That starts with your choice coming into school. That's number one. Secondly, starts with your motivation to what you want to do, how you want to go about it, and the outcome of it. You want to study law. You wrote down, did everything, and I gave you sociology. One, they have keep your passion. That's number one. What keeps a man going is intrinsic and extrinsic. You should be motivated internally. You understand? Then the external things serves as, let me just put like they're palliatives.
Yeah.
You understand? That motivation comes in personally. So now you want to study psychology or you want to do economics, you end up with psychology. You have lost passion, number one. Number two, the underlying issue again is our institutions. Psychology should be a more practical course.
Faculty of it.
You understand? It's called practical. It's more practical than theoretical. But in our universities, our tertiary institution, it is more theoretical
Than practical.
This is
The underlying issues.
these are the underlying issues.
Yeah.
And again, those theories, they're obsolete. They don't relate it.
Without practice.
They don't relate it to the Nigerian society. So as such, it becomes very, very difficult. You cannot study psychology for 4 years without using a scale. You don't know how to operate a scale. You don't know the application of it. You just have the software. Let me call it the software. You just go download it, modify it, then use. You don't have physical contact with that scale. You understand? So this thing becomes a challenge. So now when they leave school, because of the hurdles, economic hurdles, the challenges, they are looking for a paying white collar job. A psychologist working in the bank. How does that correlate? You understand? A guy who studies CRS.
To the government house.
You're in the community. So see, we don't channel our expertise. If we channel our expertise, we'll discover that we are raising champions. We don't channel it. That's the same thing I say that this shortage, you can teach, lecture, you understand, the basis for other people to hold on to cases or situations for the expert to come in. I don't know if I've addressed your concern.
Yeah, thank you very
Second
much.
question she asked.
Yeah, she asked the second question about therapists.
Yeah. The ethics is this, even in medical practice generally, right? You don't treat yourself, right? You seek for care. I would give an instance, right? I traveled, had an exam, and then I had a conjunctivitis, But I trivialized it, so that bias, that sentiment coming when you have to treat yourself. So until I called someone, we're just having a video call, and he said, "Your eyes are red." I said, "Is it that bad?" That means I hadn't even picked a mirror to look. Yeah, so the person is a doctor, so he said, "You need to get something for your eyes." So because the doctor was saying it, I left my hotel room and had to buy that night. You understand what I'm saying, right? So if you are to treat yourself, you're going to be biased, all right, on how your emotions, your thoughts, and your behaviors are, right? So I think that's it. So ethically, you shouldn't treat yourself. You should seek, even though we do it on sometimes, right? It's unethical, all right. Yeah. So that, and in fact, too, a friend had reached out to me. I said, I need therapy, and I said, okay, I'll book a session for you. He said, I don't have money. I said, don't worry. She was like, why can't you? I said, no, you're my friend. You're right? Okay, so there's what we call dual relationship. All right, so there's, because when you are seeing a patient or a client, there's a relationship formed, and what should be formed is therapeutic relationship, therapeutic alliance, right? Now, not friendship that can model, because in therapy you don't advise, you counsel. All right, so if you are a friend to your client, you risk the chances of advising, right? And then you become biased too. Imagine your friend has a problem with her husband, right? My sister that asked the question, and you are the therapist, and she's your childhood friend. You may not give fair hearing to the man. You are just going to say, "Kai, my sister, leave this." So if you have to do couple therapy, you already going to demonize the man for doing this to your friend. All right.
Right. Yeah, and you want to avoid the risk of being in a bad position with your friend. By saying that stuff. But yes, thank you everyone for being here. And I think on this note, it's good to call this episode a wrap. And quick information or just quick things you need to take away with you. Very important. Refer someone when you have to refer. You don't have to be a pro to do it. Just start something and refer to the pros as much as they can. Shed your light, shine your light. Don't be isolated, be insulated, right? And pick it upon yourself to start something.